What is Kawasaki disease? Children and ailment related to coronavirus. Children are falling ill with a baffling ailment related to COVID-19. No children are known to have died so far, but several have ended up in intensive care with mysterious symptoms that include enlarged coronary arteries. One child, 8 years old, arrived at a Long Island hospital near death last week. In the past 2 days alone, the hospital, Cohen Children's Medical Center, has admitted 5 critically ill patients, ages 4 to 12, with an unusual sickness that appears to be somehow linked to COVID-19, the disease caused by coronavirus. In total, about 25 similarly ill children have been admitted there in recent weeks with symptoms ranging from reddened tongues to enlarged coronary arteries. Since the coronavirus pandemic began, most infected children have not developed serious respiratory failure, of the kind that has afflicted adults. But in recent weeks, a mysterious new syndrome has cropped up among children in Long Island, New York City and other hot spots around the country, in an indication that the risk to children may be greater than anticipated. The number of children in the United States showing signs of this new syndrome, which first was detected in Europe last month, is still small. Doctors say this condition does not seem to be driven by the virus attacking the lungs, a hallmark of coronavirus infection, in adults. The symptoms of Kawasaki disease often start with a fever and a rash, but when undiagnosed and untreated, the illness can lead to serious heart conditions, such as coronary aneurysms. The disease, which generally afflicts patients 6 months to about 6 years old, is considered rare in the United States. On Monday night, the New York City Health Department issued a bulletin asking doctors to report any cases of the syndrome. But interviews with doctors in New York City and on Long Island suggest that at least 50 children have been treated for the syndrome, not all in intensive care. At Cohen's Hospital, in New Hyde Park, Jaden was put on a mechanical ventilator for 3 days before he began to improve. Doctors in New York have noted that cases of the new syndrome began to appear a month or so after a surge of COVID-19 in the region. In some cases, the treatment for children with the new syndrome is straightforward and quick. Early research suggests that children are significantly less likely to become seriously ill with COVID-19 than adults. In New York City there have been 13,724 deaths of laboratory-confirmed COVID patients. Doctors say that even though there is growing evidence that some healthy children are falling gravely ill with this new syndrome, they are still at far less risk from COVID-19 than adults. Thanks for watching. Please do like, share, and subscribe.